And one of the things that we tell the states when they are developing their state action plan for climate change and health is that they need to start with their vulnerability assessment. So start with your vulnerability assessment, as in what is your climate vulnerability in terms of what are you most vulnerable to? Is it floods? Is it heat waves? Then also look at your disease vulnerability. Hi, I'm Poornima Prabhakaran, Deputy Director of the Center for Environmental Health at the Public Health Foundation of India, and you are listening to Understanding the Future podcast.
Hello everyone, I'm Punit Gandhi, Senior Associate with the Climate Center for Cities at the National Institute of Urban Affairs, and welcome to the Season 3 of Understanding the Future podcast. I have been working and studying in the field of sustainability and climate change for more than 8 years, and I have realized that I have a lot of questions on how we can build cities in India that are more climate focused. With Understanding the Future podcast, I interact with experts, entrepreneurs, and government officials to understand what it takes to bring all the different solutions to the ground, as well as how can systemic changes be developed on ground. We will further anchor all the topics being discussed with different skill sets required. This will help us understand the future of cities and future of work in Indian context. If you are tuning in for the first time, do check out our previous episodes. Also, don't forget to check out the Climate Practitioners India Network, a members-led solutions-oriented platform for climate practitioners across India. And join it through the show notes. Hope you enjoy the podcast. Hello, and welcome to the Season 3 of Understanding the Future. I am your host Punit Gandhi, Senior Associate with the Climate Center for Cities. And today we have with us Dr. Poornima Prabhakaran. She is the Additional Professor and Deputy Director at Center for Environmental Health at the Public Health Foundation of India. And today, she will help us understand the topic of public health and climate change. Welcome to the show, Dr. Poornima.
Thank you, Punit. Pleasure to be here today, joining you in this conversation.
Thank you so much. I think this is one topic around climate change that I have not even brushed upon, and that is why I was really keen on getting you as well over here, because I think everyone still understands now about public health, especially with the pandemic. But if you can still elaborate more on what all other things are also there, what does public health actually mean? What are the different components of it, and how do we look at it before we, I think, go towards the climate change topic as well?
Thank you, Punit. First of all, thank you for inviting me to join you on this podcast. Better late than never. I think bringing the health lens to these conversations is really important. So to answer your question around what it entails, the whole public health domain. So let's put it very simply. It's a discipline that, helps to protect and promote the health of people and the communities in which they live, eat, work, learn, and play. So to put it in common parlance, physicians are concerned with sick individuals, whereas public health practitioners are concerned with sick populations, as in they do not want sick populations. So they are concerned with facilitating healthy environments, healthy living behaviors, and that should help to prevent people from even getting sick. So in a nutshell, that's what public health is out to do. You're going to protect as well as prevent and promote health of populations.
Yeah, that's quite well put, I feel. And I think when we look at it from the bigger perspective, like when we are talking about healthy environments, these days, especially in the smart cities as well, we have had a lot of things that come up as healthy cities and everything as well. So when we look at it from more general population, what are the different elements that a public infrastructure can be brought up on? I think it's not just about infrastructure in terms of physical, but what kind of capacity can be brought around in any area to see that, okay, there is a good public health in the society.
So let me step back a little and elaborate a little about public health itself. Broadly, when I said, we should be working around building, facilitating healthy environments and healthy lifestyles and behaviors. I think we are looking at assessing all those determinants of population health, assessing the determinants of population health, not just at individual level, but household level, community level, and regional level, if it were, as it were. You mentioned cities, so it could be cities, it could be at a state level. So we are, as public health practitioners, looking at determinants at every level. And basically what we are out to do is looking at everything that feeds into a healthy life for an individual. So availability and access to clean water, sanitation, hygiene, clean air, both ambient air, indoor air. We are looking at probably, enabling environments for optimal physical activity. We are looking at, environments for healthy behaviors, basically facilitating. So public health practitioners, they say no smoking, no tobacco, but what are those enabling environments that we need to put in place over there? So it broadly covers all of that, assessing the determinants, delineating the gaps in those determinants, a baseline assessment to look at all those determinants, various domains that determine public health, in population health. And then, doing the research that is required to back programs and policies that will be required to address these situations. And not just stop in, the research, but that research should be translated into useful programs and policies. We also, as public health practitioners, are helping to build capacities for implementation of programs. There's always this gap between policies and programs and its implementation on the ground. So as public health professionals, we are also building capacities. We do a lot of training and skill building for people to, be placed there on the ground to help the implementation of the public health programs and policies. And last but not the least, a good monitoring and evaluation program. So all of this falls within the remit of public health. And if we're looking at it from the disease lens, I think in India we are, what we call now the double whammy, but I'll talk about the triple whammy. So the double whammy, as in we are still suffering from, communicable diseases, infectious diseases, diseases related to malnutrition. And when I say malnutrition, it's both ends of the spectrum, unfortunately, still in India. Undernutrition, the starvation, there's many parts of our country that are still having poor indicators with relation to nutrition. But there's also the other end of spectrum of malnutrition, overweight and obesity. Even childhood obesity is a thing now. Beyond that, the whole lifestyle disorders. So heart disease, stroke, respiratory illnesses because of the deteriorating air quality in our country, in many parts of our country at least. We also have cancers as a consequence of, exposure to even environmental risk factors, mental health. But I think cross-cutting across all of these domains, whether it's, the different diseases that I mentioned now, is the other crisis that is creeping up on us. And that's where we talk now about the triple whammy that we have in India. We have communicable diseases, we have non-communicable diseases, but slowly creeping in on our backyard, or I suppose already in our backyards, is the climate crisis. I think that's something which is cross-cutting, and India is one of the most vulnerable to the changing climatic conditions.
That's pretty interesting. And if you can also help us understand that, okay, in triple whammy, you have communicable, non-communicable, and how does climate bring other set of risks? Because the climate-related diseases might also be inside communicable and non-communicable in certain formats.
Yes, certainly. So for all of us, I think climate change has become a very increasingly familiar term because of the impacts that it has, multitude of impacts, both direct as well as indirect consequence on not just lives, but health as well as livelihoods. So we know that all these acute climate events, whether it's heat waves, droughts, floods, storms, and what have you, all the acute climatic events have very deleterious effects on public health, both direct as well as indirect. And if I were to start, mapping those out, so air quality, deteriorating air quality has impacts on respiratory illness. That's what we intuitively think. But increasing evidence has shown that there's impacts on every other organ system from poor air quality, cardiovascular disease, strokes. Pregnant women exposed to poor air quality have adverse outcomes. So poor air quality has a range of health impacts. But in addition to that, heat sensitive illnesses. So exposure to heat, extreme heat, we have increasing not just the numbers of heat waves in our country, but also the frequency and the duration of the heat waves is changing. And the heat sensitive illnesses are another whole portfolio of diseases that we are encountering now, from simple exhaustion to strokes as well, heat related strokes, dehydration, so renal failure because of extreme dehydration. So there's all the heat sensitive illnesses. Changing climatic conditions also have become favorable for vector-borne diseases. So there comes, our communicable diseases, mosquito-borne diseases, for instance, dengue, malaria, chikungunya. They are spreading in parts of our country that haven't seen much of these kinds of illnesses before. So vector-borne diseases. We also have water-related illnesses. So, post a flood, for example, there's also the stormwater, there's increasing illness that is waterborne illness, choleras, the gastroenteritis. So waterborne illnesses and post-traumatic stress disorders. So a real connection now being seen between climate events and mental health. So that's something we don't want to forget. So across the board, there's the entire spectrum of, climate sensitive illnesses, as we call it. In relation to every climate event, we see impacts. There's a surge of diseases that's happening across the board.
That's quite a lot of new things I feel that is coming up as well, or whichever it was there before, but I think the amount of number of cases might be increasing or something. So do we have something on the lines which helps us map and specifically point it out that this is the reason that these things are increasing? Or because I'm also assuming that, so air quality, I know as much as that it takes years for you to maybe deteriorate to such a point that, okay, you might suffer condition which you do not want, but for others as well, can we account for it in the terms of health hazard, and can we mention in our maybe our reports or something that this is related to climate?
So for air pollution, definitely there is an increasing body of evidence even in India now. We ourselves have done a lot of research around exposure to particulate matter PM 2.5 being related to a host of health indicators. And one example that I can tell you straight away is in association with high blood pressure. So using a model that we have developed in-house, it's called an ensemble model. So we take into account exposure data from a whole host of sources, the ground monitoring stations that are put up, for example, by pollution control boards. We use satellite data, we use land use data, meteorological information. So all of this goes into our model, and we have estimated exposure to PM 2.5 going back to 2010 using this model. So 2010 to 2020, we have a very fine spatiotemporal resolution, 1 square kilometer by 1 square kilometer for the entire country now, exposure to PM 2.5. So we are now doing this linking to various health outcomes. And this is a consortium of researchers, international collaborators that we work with, the Harvard School of Public Health, the Karolinska Institute. We call it the CHAIR Consortium for Health-Related Air Pollution Research, because for the longest time that has been the angst, that we don't have evidence from India. So what came out of that research is for every 25 micrograms increase in PM 2.5, the blood pressure of an individual in Delhi or Chennai, we started with those two cities, can increase by 3 to 5 millimeters of mercury. And what that means is if we can reach our national ambient air quality standards in India, we would reduce the prevalence of high blood pressure in the city of Delhi by 10 to 15%. It's as simple as that. So we can convert that into numbers that speak to the policymakers. So think about how many, by addressing that upstream determinant of your air quality, if you address your air quality, you're going to prevent that many people from accessing healthcare. And we already have a very overburdened health system. We've seen that during COVID. So that is just one example. So far as actually climate, direct climate change impacts, as for example, exposure to heat waves, the evidence is just beginning to grow. Contextualized research in India. There is evidence from other parts of the world. People have gone ahead in that, but we are working here in India as well. Exposure of pregnant women, for example, to extreme heat can result in adverse birth outcomes, stillbirths, low birth weight, and that has ramifications across life for a child born with low birth weight. So the research is growing. It's certainly growing, and there's a lot of appetite for doing this kind of research as well as funding this kind of research, climate change related research. And I think it's a good environment just now to grow that evidence base for India.
Yeah, that's good to know that these things are increasing, because I feel somewhere going down the line we might need more, and with the increasing evidence-based approach that are being used everywhere, this might just help us facilitate some of the policies in future, which will take into account the statistics that come out of these researches. It's quite important. But so when we have to look at it now, let's say a city like Delhi, what kind of health hazards should we prepare for? What kind of things as a city needs to prepare for when they're talking about climate change and public health?
I mean, you asked the question about Delhi, but I would definitely like to say that, it's not a one size fits all. I can answer a little bit about Delhi, but, for a country like India, we are countries within a country as it goes.
Yeah.
So every part of the country has a different climate vulnerability, so there are states that are very prone to heat waves. There's another that's very prone to floods. So what we are doing definitely is when we are working with all the states through the Ministry of Health and Family Welfare's National Program for Climate Change and Health. And one of the things that we tell the states when they are developing their state action plan for climate change and health is that they need to start with their vulnerability assessment. So start with your vulnerability assessment, as in what is your climate vulnerability in terms of what are you most vulnerable to? Is it floods? Is it heat waves? Then also look at your disease vulnerability. So do both at the outset, a baseline vulnerability assessment, and then start to build your adaptation response. So if I were to talk about Delhi, I think that it's all over the news. It's air quality. I think one of the worst, environmental risk factors now. And unfortunately, Delhi is plagued by poor air quality year after year. So I think that's a first for them, for the state, for the city of Delhi. But if I were to pick another state, it's Orissa. You will have to look at the flood vulnerabilities, and as well as heat waves. They are prone to both. So both at the state level, but also city level. You work with urban local bodies at city level. City action plans are being crafted. But all of those definitely need to start with a baseline vulnerability assessment. I think that's the first step. And based on that, then you develop an adaptation response that takes into account every sector. I mean, definitely the health sector is front and center. As we say, in the climatic events, I think first responders are the health professionals. So they have to be prepared. They have to be sensitized. They have to be aware of the surge that's likely to happen. So, and be prepared. So air pollution season comes along. Delhi health facilities have to be prepared for the walk-ins, the increase in walk-ins from respiratory illness or cardiovascular illness for that matter. So similarly, I think every other region of the country needs to first map their vulnerabilities, and I think that will help them mount a strategic plan for adaptation and response to climate events.
Yeah, absolutely. I think this is something I think everyone is even trying to push forward as well, and especially with the NDMA coming up with the district level guidelines. I think a lot of cities now are also able to refer to that, at least to even understand that what are the different risks that they are looking at from the policy perspective. But I also think somewhere all cities or majority of the cities I see go through 3 seasons in India, and all the 3 seasons bring in some kind of vulnerability. So somewhere it's like that. It's a consistent challenge of either from going from bad air quality to bad summer somewhere, and somewhere it's flooding. So it's a constant loop. How can someone, so let's say an urban local body or someone prepared for these lines from, let's say, infrastructure point of view, strategy point of view, SOP build up point of view, to be able to deal with these things?
So, like I said before, I don't think it's a single sector response. It definitely requires working across sectors. And I would definitely say if we were, for example, thinking of Ahmedabad's heat action plan, we know that's a classic example of an intersectoral response. And it's been a very successful plan. Year after year, they have been revising that plan. And that is a plan which brought together health practitioners, public health professionals, urban planners, the policy makers, traffic police and the community together. So year on year, there's all of these people who are coming together to address the city's vulnerabilities to heat waves. And it has been shown actually morbidity and mortality from heat waves has decreased in the city. It started way back, I think, in 2010 when they had that 1 week in May. There was a huge number of deaths that happened because of the extreme heat. But that's when the heat action plan of Ahmedabad was crafted, and they are revising it year on year based on a number of consultations and indicators within the city, and it's a very intersectoral response. And I think at every level that is what we require. It cannot be done in silos, and I think this has become very cliched that we talk about it all the time, but it's true. I think even if I'm talking about the health sector, for example, it's something that they are the first responders, but they cannot do this without having uninterrupted electricity, a good supply of water. So it takes all the sectors to be working together. And I think capacity building at every level is so important for all of these stakeholders.
Yeah, I do agree, and I do agree. Capacity building, I think, eventually comes down as one of the things that is required in almost every field, which is like it's a thing which is constantly we are trying to seek, but we have not been able to seek across the country. And I do understand that intersectional things are required, but okay, let's maybe then also try to understand it that if we are taking up Ahmedabad has heat action plan. How can that be? And you already said that there are different kinds of vulnerability assessments that can be done across different cities to build these things up. Uh, how much of the capacity are we lacking to scale up it from one city to another in terms of translating solutions, translating different kind of challenges? What are the quantum that we are looking at if you have any estimate on that?
I mean, I don't have exact estimates, but I can certainly say that once there is a successful plan, it becomes a template, right? And so there are others, like Orissa also has developed a good heat action plan, Bhubaneswar, for example, and both of these incidentally are Indian Institutes of Public Health, PHFI's institutes in Gandhinagar and Bhubaneswar. But it is a template that can be scaled up. It can be picked up and scaled up in other cities if they have the same vulnerabilities. What it requires is, I think, one, political will. It requires unlocking the finances, the fiscal mechanisms, and it requires capacity building. You have to, take that away to another city. Then you need to map all the people who need to come together to deliver a plan like that. And unlock the fiscal mechanisms for that, build the capacities, and get it going. And in a timely manner. I mean, you can't have a heat action plan kicking into play at the monsoons. So Ahmedabad heat action plan actually starts off February, March, and they have everything in place by, just before the heat wave season. So I think there's lessons that can be learned. These are all best practices, and it's like a exemplar of best practice for addressing heat waves. Similarly, I think, flood resilience or, air quality action plans. I mean, there are few that can be emulated, but I think it is still work in progress. And I guess we are on a path to getting there, but maybe not at the optimal pace.
I do agree. I do agree. But so I will come back to I think we have covered somewhere air quality and heat action plan. But from the flood perspective, what are the major challenges that comes up on the infrastructure? What are the major things that they need to be accounted for from the public health point of view?
So I will give the example of Kerala actually. So, the floods that happened in 2018, and I'm speaking from the health system view. The facilities were washed away. I mean, PHCs, CHCs, there were lots of. So that's what we say, that we need not just structural resilience, but we also need functional resilience. I mean, they should be in a sense the last building standing, but also functioning. And that kind of preparedness can only come. Okay, there were lessons learned. So going forwards, they have learned their lessons and have rebuilt their PHCs, for example. I myself visited a couple of them recently. And what they did was looked at the historical flood levels. They moved it a little away from, from the low-lying areas. They put in structures in place, mechanisms in place. For example, the emergency care services are at the higher levels. stocks your medical equipment, pharmaceuticals at a higher level. So little steps like that. So then, putting barriers for the stormwater drains, as well as rallying the community. I think it was a whole of community response as well. There were volunteers, youth, everybody who came into action together to help those communities. And I think that's where the learnings come from. I think that was a classic example of flood resilience. And now those are very sturdy, functioning healthcare facilities which are equipped should another flood happen. They are better equipped to handle this kind of situation, but also they are better equipped and sensitized about the diseases that can come with a flood. Post a flood, waterborne illnesses is very common. There's also issues about access for food, access to healthcare itself. I mean, you have people coming in boats after that. So they're prepared and more equipped now. So I think that example in Kerala is a very good example that we talk about it all the time.
Yeah, I think good to know that Kerala has been able to now develop this kind of system, and I think these are pretty important as well. And I do understand you had also brought up with the floods and all, there is a huge chance of vector-borne as well. It's important to cater to. And I do remember having experienced the Surat floods twice. The amount of chlorination done post the flooding to just stop this kind of stuff. But again, so now I think one thing that is on the line is climate anxiety is something which is pretty common. We picked up by a lot of young generation at least, or at least they are speaking it out more often. What is it about? What are people trying to do to solve it? How can that be catered to in the population, from the population perspective? What can be done around those lines?
I think the sooner we understand the urgency of the crisis and come together to address it, the better. I think the youth, they are more aware, they are more sensitive, I think, to the changes that are happening. And I think the youth voice has become front and center on all the climate conversations. I must say, I was truly impressed. I was at the COP meetings in November last year, and there's an entire passionate youth delegation that is there and, front and center, trying to have a seat at all the conversations. Pretty impressive. And it's not just and not just like, Greta Thunberg or, people from our country. There's people rallying together from around the world. It's a real thing. I mean, I think they're worried for the future. It's not just air quality. There's so many things like climate migration, has led to a lot of conflict. It's a concept that we're increasingly recognizing now. Migration because of climatic conditions, acute climate events, and then all the ramifications of that, access to basic necessities, air, water, food, healthcare. So I think that way it has very far-reaching consequences, and definitely the mental health of young people around the world, because the more sensitive and aware they are, they're more worried about what the future holds for them. And I think fair enough. I think the world we leave behind, I think everybody should be concerned about, and a very concerted response is required across the board. And all these conversations about, net zero by 2050 or 2070 or whatever it is. I mean, I think they require very clear-cut roadmaps. Every country has to take a charge. And we talk about, the UNFCCC talks about common but differentiated responsibilities, because every country is at a different starting point. But I think there's no place for complacency, because I think we have a responsibility to our younger generation. And the anxiety is fair enough. I think there's a lot of room for concern.
True. I do agree, and I do agree. Like, I think this also kind of was pretty visible when I think COVID started, and all of a sudden the air pollution kind of went away in a week or something. And everyone, it was all over the media, it was all over the place. But COVID is still going on. It's a big thing, I guess, for people to at last see the blue sky in the winter months, which was not possible to see. But okay, backtracking a bit, what kind of infrastructure challenges have now been recognized, especially after COVID? That yes, it is something like this. The pandemic is a challenge, but even with more and more sort of public health hazards coming into picture. What kind of infrastructurally sound systems do we need to create across cities? Has there been some kind of a template that has been taken out that how this can be catered to or something, but at least to make sure that there is enough health capacity or infrastructural capacity to cater to everyone?
Well, certainly COVID showed us we were far from capacity in terms of, a good health response when COVID happened. And I think we were not there even before COVID, right? So it only got aggravated, and hence, the scenarios that we saw during COVID. But having said that, I think there is now an awakening. I think it is recognized now that public health is so important. There wasn't a cadre for public health professionals, really. I mean, in the whole system, there wasn't a cadre of public health professionals. That was actually the vision with which Public Health Foundation of India was actually set up, to create that cadre, train public health professionals. So I think there is that awakening now that we need to strengthen our health infrastructure, not just in numbers. I think where the numbers are there, we don't have the personnel. So I think there's a gap in every block over there of building the health infrastructure. If we have the buildings, we don't have the people to work over there, and if we have the people to work there, we don't have comfortable working environments. I think that's also important. So building infrastructure, so for structurally resilient but also functionally comfortable working environments with all the resources that are required to deliver good healthcare. A continuous supply of electricity is so important. Uninterrupted electricity in a PHC or a CHC is so important, especially when you have such high rates of infant mortality and neonatal mortality. If you don't have electricity, you can't have a functioning labor room, you can't have a neonatal warmer, and so you have newborn deaths. So I think there is that sense now that it requires strengthening across the board. Funds, I think, is always an issue. Financing, or if the financing is there, they are infusing the system with finances maybe, but people don't know how to use them, because oftentimes it happens, like things are budgeted for and they go unspent. I think this is a case with every ministry that we are hearing about. I mean, there are climate action plans within the health ministry. There's the environment ministry, which is also having a national climate action plan, a national clean air plan. There's lots of intentions, but delivery on the ground suffers at the end of the day because we're not thinking in a decentralized fashion. So I think it requires both a bottom up as well as a top down approach to address these issues, and the sooner we get there, the better. India being such a vulnerable country.
No, I agree. And I think you brought up the financing as well. I do believe financial challenges are quite humongous, and as you're saying that the usage becomes also a challenge. Is there also a way in which maybe some sort of privatization can happen, or some other kind of models that can come up, which have worked across different countries, maybe not in India, but other countries, and that have supported public health infrastructure in a better way possible?
I mean, there's always room for public-private kind of partnership. PPP model, I think, is very good, and transfer of climate finance from developed countries to developed countries. It's one of the UNFCCC mandates, right? So, I mean, the more that happens on a needs-based kind of approach, like there are a lot of developing countries, small island developing states, and even within India, if you just think of India as a country, there are some countries or states or districts that are more vulnerable. So picking up those highly vulnerable districts or states and focusing on them may be a starting point. So at least you're helping those most at need, rather than dissipating resources in kind of some wasteful expenditure which is not going anywhere, not helping neither the health nor the livelihoods of people. So I think it's very important to do a scoping of the entire situation at every level, national, subnational, district level, and get your act together. See where your vulnerabilities are. If you're looking at air pollution, which are your pollution hotspots? Which are your hotspots? Focus on those. I think we do have the National Clean Air Program, which is supposed to be focusing on some 132 non-attainment cities. what's really happening on the ground, I don't know, much detail about it, but I think that's what is required. Complete transparency, ownership, accountability. So people are really using the funds for what they're supposed to do, have the capacity to do so. Oftentimes that's the case. I mean, pollution control boards are given certain responsibilities, but maybe they are not able to deliver for many reasons. The funds, or they're overworked, or they don't know what exactly they're supposed to do. So the same holds good, I think, for a climate response as well. I mean, it's a very broad thing, but it also can be granular in terms of actual action on the ground.
True. I do agree. I think it needs more systemic development of things at each level for it to be able to integrate it at each level and then hopefully get a better uh, evaluation and impact out of it as well. But coming more on the lines of then now a lot of things are developing and a lot of new wave of innovations are also coming in, especially with startups as well. Do you see any specific field or interest area where more startups are picking up in public health space or can pick up in public health space that startups have not recognized from the innovation perspective?
I think the one thing that came to the fore during COVID, at least, was telemedicine. Digitalizing healthcare and telemedicine has become more of a thing now, especially during COVID. People needing to access routine healthcare did it through video calls, telemedicine. So I think that's also a good thing because it cuts your commute. So you don't have to do your commute. You can access healthcare sitting at home. That's good enough. So I think there are new innovations. We have a Center for Digital Health as well in PHFI that was set up during COVID. So they're looking at the concept of assisted telemedicine, given the fact that you might have telemedicine, but people may not have internet services to access that healthcare. So there is this bridge, bridging that gap through a concept of assisted telemedicine. So we are testing this out in a couple of locations, in at least 3 locations now. It's very successfully running, where you have a one-stop shop where people get everything. They get assessed, they get connected to an expert through telemedicine, they get their prescription, and they're out. So those are new things. I think that's one example, but there's also green technology, energy efficient medical equipment. And we should build demand in the health system for only very sustainably produced equipment or pharmaceuticals, for example. So, for example, if we're talking about the health sector footprint, we're contributing globally about 5% of the GHGs, greenhouse gas emissions, the health sector alone. And a big proportion of that is from the supply chain. So, the supply chain should be one of the first places that we need to address if we want to reduce our footprint, the health sector's footprint. So, maybe demand aggregation for only sustainably produced and supplied goods and services. So, for example, a manufacturing unit that is taking environmental sustainability into account while doing their production. So we are working on some of those things as well. So, people who are taking into account sustainability, environmental, waste that goes into the environment, all of that is taken into account. So we should buy our goods and equipment only from those kind of manufacturers and suppliers. So a huge part of the footprint of the healthcare supply chain can be addressed. I think we've talked about hydrogen ambulances in the COP. I think there was one on display over there that the NHS had. NHS is the UK health system, so they had the hydrogen ambulance, which they were already using one in Birmingham, apparently. So there are new things coming out, and at the COP also we had curated a whole program around Future Lab. It was called Future Labs, which is actually case studies from around the world of good examples of sustainable healthcare, basically. So there's a book of case studies from around the world, and our assisted telemedicine also figured there. So I think it's there. I think innovation, there's always space for innovation and technology, and we should leverage it because I think it's the way to go.
Yeah, absolutely. I think that is one good thing that is currently happening as well. Is a lot of people are recognizing all the different problems statements and trends solve it in as many ways. And because, as you also pointed out, it's the intersection of solutions. It is not just one solution that is going to work out. And I think this is where a lot of tech industry is also trying to pitch in, that how can they make the standardization can happen. Now, from I think this is one of the last questions that we ask all our interviews, that and this is something which brings us to the lines of skill sets, because we do believe that to develop all these things, it's important to develop skill sets in people, and to develop public health in general. Let's say climate change will be a subset of it. What are the different specific skill sets that any professional needs to have or needs to develop to be able to work in this sector?
So, specifically climate change, or you're talking?
Generally about public health.
Yeah, I mean, you can't have everything. Public health is also a very multidisciplinary kind of domain. But within that, we work with a lot of different domain experts. So we need epidemiologists, who can study the dynamics of disease transmission and stuff. So even within that, you have infectious disease epidemiologists, you might have a non-communicable disease epidemiologists, but yeah, epidemiologists are very important. Statisticians, biostatisticians, because you need to do all the modeling and the analytics for, the disease transmissions and stuff. Social scientists, I think it's very important to have a lens of qualitative research to study the behavioral patterns and stuff. So I think that's important. Nutritionists, we have laboratory personnel, because oftentimes you need to do these measurements and stuff. So, people working in laboratories for assessments, exposure assessments of heavy metals, for example. So there are blood biomarkers, for example. So, and of course, I think it requires coming together. For example, my own team at the Center for Environmental Health in PHFI is very multidisciplinary. I even have an environmental engineer. So, it's such an interdisciplinary domain of environmental health. So we have the works, we have a nutritionist, we have a social scientist, we have, an environmental engineer, we have a climate scientist. So I think it requires all those skill sets to do, a good piece of work, whether that's research or you're thinking the technical inputs that you need to give to a program or a policy. It requires a very diverse kind of insight to come together to address these issues. So I think public health tries to get in all of those domain experts when we work.
That's great to hear, because I think this is quite important. But I think I'll also like to add one more question on top of it, because I've generally received this question a lot, especially from all my doctor friends, that either working as a doctor or dentist or physiotherapist. What can we do to make sure that we can contribute to this? Because they are not sure how to take it forward based on their current practices.
Yeah, interesting, because and fair question, because climate change, forget climate change, air pollution even is not in the medical curriculum. So they are really not aware. I mean, when I studied, it is not part of the curriculum at all. So one of the first things that we are doing is to educate the doctors themselves, about the issue of air pollution. When they are seeing their patients, are they even thinking of exposure to poor air quality as a reason for why the patient is sitting there in front of them? So we actually have done a study in some tier 2, tier 3 cities. We went and interviewed physicians, pulmonologists, pediatricians, cardiologists. Are you thinking about air pollution when you're seeing your patient? And the answer is, that's a Delhi problem. So even doctors don't relate to air pollution, an issue like air pollution. I think now with a lot of awareness building programs and sensitization, doctors are more aware, not just doctors, we're even talking to nurses. So we have a network called the Health and Environment Leadership Platform, which is a network of hospitals and associations of healthcare providers. And we are sensitizing them through a lot of our programs and webinars about all these environmental issues. So they become environmental stewards in a way. So at individual level, of course, we want them to think about issues like climate change, climate pollutants, and air pollution, so that they can advise their patients, when they should not be stepping out on a poor air quality day, or, taking steps, for example, in anticipation of a heat wave. So doctors themselves also need to, have this continuous medical education, I think, about these environmental issues, because as we know it now, about a quarter of the global burden of disease is due to environmental risk factors. So I think it doesn't come in the curriculum, and we are hoping to make that change soon. There is a global movement actually now advocating for that, to bring climate change and issues like environmental issues and their impacts on health into medical curriculum. And it's happening in some parts of the country, yet to happen here. But we're very fortunate that we've started talking to medical students, the future doctors, as you know. So they are very aware and they are very enthusiastic. So they have a global network of medical students who are working to, towards enhancing awareness about climate change. So individual doctors at individual level, they can do so many things. One, to become aware themselves, but also to educate their patients about preventive and promotive measures for their own health, I think. And little things at household level, I think, commuting. Don't use, disincentivizing private vehicles and using public transport. Those are little things. Waste management at the household level. All of those contribute to their own climate footprint. So I think these things you can tell them. And, these are individual level actions that you can take.
Absolutely. I will make sure that they hear this thing out, so that they are now more aware about it and have the answer from an expert itself. Thank you so much. It was great speaking to you and understand more about this topic, because I think this was something important that even I wanted to know more about and learn more about. I have not come across this that frequently yet.
Pleasure. Thank you for the opportunity. It was my pleasure completely to interact with you.
Thank you so much.
Thank you for tuning into the podcast. Do subscribe to the podcast on your favorite platform and follow us on all social media channels. For more details about the Climate Center for Cities and registration on Climate Practitioners India Network, click on the link in the show notes. The episode is conceptualized and produced by Punit Gandhi. A big thank you to the whole team at C-Cube and NIUA for supporting the development of the podcast. Stay tuned for the next episode.